What are the symptoms of gastric outlet obstruction, GOO, from ulcers? Imagine feeling like your stomach just can't empty properly. That's what happens in gastric outlet obstruction caused by ulcers. When an ulcer causes scarring or inflammation at the pylorus, the stomach's outlet to the small intestine narrows or blocks. This prevents food from passing smoothly, leading to a specific set of symptoms. One of the main signs is recurrent vomiting. Patients often vomit undigested food several hours after eating, sometimes late in the day or up to 6 hours after a meal. The vomit usually doesn't contain bile because the obstruction is before the point where bile enters the digestive system. This vomiting can be large in volume and happen repeatedly, especially after meals. Many people also experience persistent fullness and bloating. Even small amounts of food can make them feel overly full or uncomfortable. This sensation of early satiety means they feel full quickly and may avoid eating more. Along with this, nausea is common, often related to the delayed emptying of the stomach. Upper abdominal pain or discomfort is another typical symptom. It may be related to the ulcer itself or the stretching of the stomach caused by retained contents. During physical exams, doctors might detect a succussion splash, which is a splash-like sound heard when shaking the abdomen several hours after eating. This indicates that food or fluid is still sitting in the stomach. In thin individuals, visible stomach contractions called peristalsis might be seen due to stomach dilation and muscle hypertrophy. In more severe or long-lasting cases, signs of dehydration and malnutrition can develop. Patients may look thin with muscle wasting and show signs of dehydration like dry mouth or low blood pressure. Electrolyte imbalances, especially from frequent vomiting, are also common. If the condition persists untreated, weight loss becomes significant, leading to cachexia, which is severe muscle wasting and weight loss. Overall, these symptoms reflected the mechanical blockage caused by the ulcer's scarring or inflammation at the pyloric channel. The blockage causes the stomach to retain food and fluids, leading to vomiting, bloating, and discomfort. Because of ongoing vomiting, metabolic alkalosis can develop, which is an imbalance in the body's acid-base levels. Doctors diagnose GOO through a combination of medical history, physical exams, and tests like gastric aspiration, which shows retained food or fluid after fasting. Imaging studies and endoscopy help visualize the site and cause of the blockage. Treatment focuses on relieving the obstruction, often with medications to reduce stomach acid, decompressing the stomach with a tube, correcting dehydration and electrolyte issues, and sometimes using endoscopic procedures or surgery if scarring causes persistent blockage. In summary, the main symptoms of gastric outlet obstruction caused by ulcers include recurrent vomiting of undigested food, early fullness and bloating after eating, loss of appetite, weight loss, and upper abdominal discomfort. Physical signs like gastric retention and dehydration are also common. Recognizing these signs early and seeking medical care can help prevent complications and improve recovery. Always consult a healthcare professional for personalized diagnosis and treatment options.